I am Diana Kerwin. I am a physician and I've specialized in patients who have brain diseases, typically that affect their memory. So a lot of them are Alzheimer's and other dementias. But what I'm doing here today is we really are trying to get good information out to the community. You know, we can't cover everything, but I'm going to try to go through really where we are with our understanding of dementia, how we diagnose it, where we are with treatments, what you should talk to your doctor about, and also a bit about clinical trials, about research, because that's something that's important for all of us. In order to find treatments to cure diseases, we all have to participate in clinical trials and research. That's the only way we find out if these medications are going to work. So our mission, this is the mission of the foundation. I have a separate research center, but the foundation mission is really to address the barriers that people have to getting diagnosis, getting into their doctor's office, getting the right information, getting into research if they want to participate in research. And so that's why the foundation is participating in community events so that we can talk about how we can address these issues. And today this is all about you and learning about your brain health. So ask questions. Definitely we'll go through a lot of information, and you can take notes about what you're interested in, what you want to hear more about. A lot of people don't know about research and what that really entails, so we'll get into that a little bit, because if you were thinking about it, I want you to know ahead of time of what it really means. It's not that you're the guinea pig, you're really participating in a scientific team to gather data to determine how we can better treat diseases. And so that's a really important part of this as well. So this is a really common question. When you can't find your car keys, or you can't find your wallet, or your purse, do you get concerned that it might be a sign of something?
No. Because it happens often.
Yeah. Okay, it happens a lot, exactly. So there's definitely, you know, the brain does age. We don't stay the same person throughout our lifespan. Our brain also, when you're born with all of the neurons you're gonna have for your whole life. And so those neurons get put to use in school. You train them to learn information, retain information. They learn throughout life. But the brain does age like the rest of the body, but it doesn't mean it should age to the point of you can't remember well enough to function when you get into your adulthood, especially when you get into retirement years. It is not normal to have so much memory impairment that you can't live on your own, take your medications on your own, pay your bills, remember your friends' names at church, remember what time to go to church. Those, you should be able to retain enough function as you get older to be able to be independent. But there is some changes of the brain as we get older. It's not as quick and as fast as it was when you were younger. I like to liken it to a computer or your phone or whatever. When you get that first new computer, it's really zippy and fast, and it goes fast, you can find information on it. But then after you download, you know, 20,000 photos of your grandkids or whatever else you have in there, all of a sudden you get that circle. It's looking. Our brain does the same thing as you get older. So when you're trying to remember that name of someone that maybe you met last month, but you don't know them that well, and you can't remember that name right away, but it comes to you eventually, that's a normal part of aging brain. So a lot of times what I tell people is you have to like give the aging brain a little bit of hints of what, like, I remember I met her, she was wearing a beautiful fuchsia blouse and her name is Helen. You know, those types of things. So you have to kind of be more mindful about putting more information together. But that's normal aging. So what's not normal aging? And this is where the Alzheimer's Association puts out the 10 signs of Alzheimer's disease, which is one of the most common causes of memory loss. It's not the only one. But there are some things that are, you know, maybe early signs of Alzheimer's, and some things that are just normal age-related changes. So typical age-related changes, maybe you decide to take a route that puts you in heavy traffic. That's not a good idea, but it doesn't mean it's a bad sign. Someone with early Alzheimer's sometimes can make lots of really bad decisions, like giving away their money, giving out their social security number on the phone, things like that, which can happen to any of us. But someone with early Alzheimer's may not realize the implications of how bad that is, or they may do it again and again. So that's a little bit different. Someone with just some normal age-related changes, you might maybe be late on paying a bill occasionally, maybe forget that you put that check in the mail, but you kind of rectify it later. Someone with early Alzheimer's memory loss might not be able to pay their bills, or they pay their rent 3 times in 1 month, or pay the utility bill, or don't pay it at all, and all of a sudden the lights go out. And so that's something that's a little bit more concerning. Other things that are concerning for someone is if they're losing track of the season, like forgetting that there's holiday programs coming up and there's going to be a family gathering, who's coming, asking over and over again. That's usually a sign of concern. Someone who has trouble recognizing really familiar faces. So like I said, someone who you just met last month once, if you don't remember their name, that's normal. But someone who sits next to you maybe all the time, someone in your family that you should know, that would be a sign of concern. The other thing is difficulty misplacing things. So we talked about the keys. So again, it would be the point where you lose the keys and you can't find them anywhere. Don't even realize that you lost them. Or find them somewhere strange, like find your purse in the freezer, or find or can't find where your car is parked, or someone can't find where their car is parked. And instead of realizing that they put it somewhere in the parking lot that they just forgot, they come in and say, someone stole my car. So not putting together that they forgot it. So one thing about someone with early memory loss is they don't even realize they're forgetting. Normal memory loss with aging is we realize we forgot it. We remember that we misplaced or whatever. We know that we forgot it. Now we just have to retrace our steps and find it. Someone with early memory loss that's due to a disease state doesn't even realize they're forgetting because the brain is masking that. So the reason these are important is we should all be advocates for ourselves, but because the person with early memory loss, that's a problem, can't advocate for themselves because they don't realize it's happening to them, it oftentimes is a friend or family member around them that says, we need to go talk to your doctor about this. I'm noticing some changes. And we need to feel empowered and advocate for somebody, because doctors don't always screen for memory problems in the office, and they don't ask about it. And if you ask someone with early signs of memory loss, they're going to say, my memory's pretty good, because they don't remember that they're forgetting until you remind them. And they might even remember that when you tell them, do you remember, Mom, you forgot, so-and-so's birthday or what have you. So they don't even realize it. So really kind of have to advocate for them and help them with that by bringing it up to the doctor is really your first stop. So the next part is we're going to get into some definitions, because this is where, I think the biggest challenge of brain diseases is just the words that we use, the nomenclature. Even other physicians, when I talk to them, because I'm kind of specialized in this area, even when I talk to other doctors, they may not really know what's the difference between dementia and mild cognitive impairment, or dementia and Alzheimer's, or Parkinson's dementia, or things like that. Because once you get into your specialty area, even doctors have different languages. So it's important that we're talking about the same thing. Dementia is a very broad term. Dementia is sort of like when someone says, oh, I have a chest infection. Very broad term. Well, what is it? Is it pneumonia? Is it bronchitis? Is it viral? Is it bacterial? What type of chest infection is it that you have? That's kind of where dementia kind of is anything that affects your brain, that makes your brain not function the way it was throughout your adult life. So this could be lots of different things that could affect your brain function. And it could be something that's reversible. Like, what if the doctor put you on a medication that makes you feel real groggy and confused? Doesn't mean you have dementia, it means that medication is causing some brain changes. And when you take that medication away, the brain comes back to normal function. That's a pretty common one. So dementia, like I said, is a clinical term. It's basically anyone. It's a big umbrella, big group of diseases and things that are reversible, like medication changes, that affect someone's brain function to the point where they're not the way they used to be. They're not the way they were last week or a few months ago or a few years ago. It's different for them. The reason why you hear Alzheimer's and dementia used sometimes separately, sometimes the same, is it's the most common cause of dementia in the United States. So someone coming into my office that I diagnosed with enough memory impairment to be termed a dementia is more likely than not to have Alzheimer's as the cause of their dementia than something else. So that's why sometimes people put it like right away, it must be Alzheimer's because it's the most common, but there are other causes. And that's where it's important that the doctor really looks a bit further, because the medications that are being developed now are becoming more specific to the cause of the dementia. And you don't want to get a medicine for a dementia you don't have, or not get the right medicine for the dementia you do have. So that's where the doctor does need to do an evaluation, and we'll talk about that. One thing about Alzheimer's dementia and some of the other dementias is it's not just memory impairment, but oftentimes the person's personality or behavior starts to change. And that's a real key sign that something's really changing in the brain. Maybe they're not as friendly and outgoing as they used to be. They get more withdrawn, they want to stay home, they don't want to go to church anymore. And some of that is because it's getting harder to interact with people because they're forgetting things, and they don't want to feel uncomfortable because they can't remember the names of the people around them or the words to a song or something. That's a really important part. The one thing that's important about Alzheimer's and other dementias is it is not something the person is making up. There are changes in the brain tissue that are happening that if we do the right test, we can find out what the reason is. One thing we talked about, mixed dementia is very common. So mixed dementia means someone who maybe has Alzheimer's, but also has some stroke-related changes in the brain tissue. It doesn't mean the Alzheimer's isn't there or the strokes aren't there. It means together they've both created more injury to the brain tissue than either one alone. And like I said, some of the causes of decline in memory can be reversible. That's why the doctor should do an evaluation, and that's why you should go to your doctor early on, or get your loved one to the doctor early on. There's medications, there's thyroid problems, there's vitamin deficiencies that can cause brain changes that if they're caught and addressed, the brain function can come back to normal again. My job, as I told you, I'm a dementia specialist. Well, what does that mean? What it really means, and the most important part of it, was when someone comes to me answering the question about their memory loss or their concern about their brain is this normal aging or is this something of a disease state? And then what's causing it? And the what's causing it is really the most important part of that. Like I said, you don't want to be labeled with the wrong diagnosis. And you want to get the right diagnosis because that's the information you're going to go seek out. You're going to go Google it. You're going to probably look up what are the treatments. It's going to be important that you have the right name to it. So the reason that it's important to think about this kind of tells us it's not just Alzheimer's. There are other causes of dementia. And I don't have Parkinson's on here, but Parkinson's actually it does cause dementia sometimes, but it's more likely to cause motor symptoms. But with Alzheimer's, that one tends to be more of a memory impairment. It tends to occur very gradually. It's usually short-term memory. So the person may retain the ability to remember things from 30 years ago. If they play the piano, they'll still remember how to play the piano. But something that just happened to them in the last few days or something on the news that they heard about or read about won't stay in the brain. That's very typical of Alzheimer's. Vascular is another name for stroke dementia. So that's where someone either has a very large stroke where they have weakness on one side, slurred speech, and as they recover from that stroke, parts of their memory that was affected, or maybe their language, their word finding ability, doesn't come all the way back, and they're left with a deficit there that could be termed a dementia because their brain function now is different than it was before. So that tends to be about 10 to 40%. Vascular could also be lots of mini strokes. Lots of really, really small strokes you don't even realize are happening over the years, and then you get to a certain point where so many of them happen, and now the brain function's not as good as it used to be. And that's something the doctor can see on an MRI. Lewy body. Anybody heard about Lewy body disease? So Lewy body is an interesting, it's sort of a mix of Alzheimer's and Parkinson's type of symptoms. Someone could present with falls. They could have maybe some difficulty walking, but then they're also having changes in their memory at the same time. So that's why it's different from Parkinson's alone, because Parkinson's alone tends to be motor symptoms only, maybe difficulty walking, maybe a tremor, but their memory is normal. This mixed Lewy body tends to be where both of those happen at the same time. And it's important to know the difference between that because it does get different medications than we give for Parkinson's disease. So that's why we do an evaluation for that. And then this group that says 10% says frontal temporal. Frontal temporal dementia actually is a lot of different dementias. It tends to be patients who are younger, and they present, because it's in the front part of the brain. The front part of the brain is our personality and our judgment. You know, like, do we go outside when it's 100 degrees wearing 3 overcoats? It's that type of decision making and judgment that gets affected early on. They also tend to be younger. The patients that I've diagnosed with frontal temporal dementia tend to present when they're in their 50s, maybe early 60s. Alzheimer's tends to present a little bit more when people are in their mid-60s to later. So someone who's 60 years old who is having personality changes, I start to think about a frontal temporal dementia. Or if they're having trouble with word finding, there's some frontal temporal dementias that just affect the language area, and the memory's fine. So that's where this evaluation becomes very important. Some other things to think about, and this is why talking to your doctor early on is important, is there are other reasons that you can have memory loss, so that's why the evaluation is important. Even if you end up with a diagnosis, or let's say before, so if you're thinking about prevention, there's some really simple things that you can do to help prevent and that you can work with your doctor about. High blood pressure. So poorly controlled blood pressure throughout life, significant risk to cause dementia later on. So that's why even if you're in your 30s or 40s, if you have high blood pressure, work with your doctor to get that under control. Whatever medications, diet, exercise, it's really important. Same thing with cholesterol, same thing with blood sugar if you have diabetes. So those are the things that you and your doctor are a team on, of let's get this well controlled. Don't let it just float up high and think nothing's going to happen because you're not worried about a stroke. It will, over time, put so much pressure on those blood vessels in the brain tissue, it can start to cause damage later on. And so those are the things that we talk about as well. The other thing about Alzheimer's now, and this is the hopeful part of this, like I said, I've been doing this for 22 years. And when I say this, I mean diagnosing people with memory impairment and then coming up with treatment plans. We never had medications that could change the course of Alzheimer's disease for 20 of the years that I've been practicing. The last few years, there's been some medications that were developed in clinical trials that are now being used to treat Alzheimer's and change the course of the disease, slow it down so the person doesn't maybe reach the later stages of dementia as quickly or even ever. So that's where the important hopeful part is now, is that we've had a lot of advancements in this area. This slide is busy, but this you can also look up. This is a service of the Alzheimer's Association. Is every 2 years they put out updated facts and figures about Alzheimer's disease. And so they start to tell us really important things like, did you know that Alzheimer's kills more than breast cancer and prostate cancer combined for someone over 60? So a woman at 65 years of age has a greater risk of getting Alzheimer's than breast cancer. So when we think about prevention and what we should be doing to keep ourselves healthy, a lot of us think about cancers, but Alzheimer's can be very debilitating as well. It is very common. It's increasing because we're living longer, fortunately. The good thing about living longer is our bodies have been taken care of, but we have to take care of the brain so the brain can also live longer with us as well. And so that's where keeping that brain healthy, diet, exercise, blood pressure control, cholesterol control, diabetes control is really important throughout life, because it'll end up helping you or benefiting you when you're in your 60s, 70s, and 80s, because the body and the brain are then both healthy. So how do you talk to your doctor? Has anybody brought up to their doctor about their memory? Or yeah, it's important. And as a physician, we think that people will tell us things when we're in the office, but we're also very rushed. You've got 7 minutes on average, maybe 12 minutes. So you really have to kind of go in a little bit prepared. And not that your doctor's on your team, but you have to go in and with the right information so that they can start doing the right type of evaluation. So this is a slide you could take a picture of as well. So you brought in your spouse, family, and friend. This is where, advocating, like I said, the person with neurologic diseases oftentimes doesn't realize it's happening to them because the brain's very, very proud. It tries to hide the fact that it's not working as well. So if you notice changes, you're the one that's going to have to bring it and say, let's go talk to the doctor about it. I'm not sure this is anything, but I'm noticing X, whatever it is. You're not walking the same, you're falling, you're having trouble with your memory. So that's where it's really important. So the first thing is to bring someone with you, or go with your loved one if you're concerned. Bring a list of all of your medications, including all the vitamin supplements and everything else you're taking. Why is that? Like I said, sometimes there's, how many people have more than one doctor? First, let me put it that way. Right. And does this doctor prescribing something ever tell the other doctor that they're prescribing? Not all the time. You know all the medicines you're taking every day. You also know all of the vitamins, supplements, your friend who says, oh, this is good for your memory, take this, right? You want to tell your doctor about all of those. And the reason is, number one, the prescriptions, like I said, some of the prescriptions can have memory changes. Sometimes that pill you take at night for sleep, like Benadryl or Tylenol PM or whatever, that can actually cause some confusion in the morning. So your doctor needs to know about that, because that might be something you could stop. All the vitamin supplements that we take, sometimes it can be too much of a good thing. The vitamins that you take should be a little bit tailored to you of what exactly do you need to take. Do you need to take a vitamin D? The doctor should probably check a vitamin D level and see if you need it. Do you need a vitamin B12? A B12 level would be good to tell you that. Do you need calcium? Knowing how your bone health is. So knowing what you're taking is the first thing the doctor really needs to have in hand in order to know how to help you. The one thing about memory loss evaluations, Medicare does have a specific program called the annual wellness visit. Everyone who's a Medicare beneficiary is entitled to a very extensive physical with their doctor. It's paid for by Medicare, and it does include some type of evaluation for memory. And then, like I said, all these other things like your thyroid, if that's not in the normal range, that could be a cause of memory loss, vitamin B12, and also reviewing your medicines. So the doctor can really get into a lot of information. They have more time during the annual wellness visit than they have during a regular visit. And then the other one is testing. So let's say you do go to your doctor and say, I'm having some memory concerns. How could they test your memory? There are some short tests they can do in the office. There's something called the mini mental status examination. That's the one where they ask you, tell me the date, the season, draw a clock, maybe do intersecting pentagons. It seems really simple, but it can pick up early signs of changes. It can. It's sometimes if it's so the one thing about the test is that if you come into me and you say, my memory's not as good as it used to, I'm having difficulty here, here, and here, and it's a very big change, and the test is normal when I test it in the office, I don't stop there, because I still haven't figured out what the cause is for the changes you're noting. So then I have to do a little bit more. What does a little bit more mean? A little bit more tends to be something called neuropsychological testing, which is a different type of doctor. It's a PhD doctor that just does a very in-depth number of memory tests and can tell you really where are the areas that the brain is weaker than it should be. And that's where we can pick up on an early sign of a problem. So that is one. Neuropsych testing is something that can be requested and can be covered by Medicare as well. I think we talked about this already, about being an advocate for yourself, for your loved one, for your neighbor if you're noticing changes. Again, we talked about some of the common things that you should be concerned about. Someone's change in personality, drawn and irritable, forgetting to take their medications. Sometimes those could be depression, and that's just as important to be evaluated by your doctor as memory. So having that as well. Maybe getting lost while driving, missing appointments or significant events, increased confusion during a hospitalization or illness. This is an important one. Has anybody seen anybody after a surgery, like maybe they have a knee replacement or a hip replacement and they seem really confused right after surgery? Okay, so some of that can be anesthesia related. There's something called post-anesthesia cognitive decline. As they recover from the surgery, that can come back, so sometimes we'll give them some time. Like we wouldn't do memory testing on them right after the surgery. We would probably give them a few weeks. But then if they're 3 months after their surgery and they're still having confusion and memory loss, that needs to be evaluated, because what happened is the surgery didn't cause it, but the surgery kind of opened up the curtains and made it come to the surface so that you're seeing the changes that they were having that now they are not able to compensate for them anymore. So that's an important time to evaluate memory, is if someone had confusion during a hospitalization. So what testing can be done? So what can your doctor or what can I do to test for memory? So we talked about the neuropsychological testing. That's done by a PhD doctor. Has really, really intensive. Can take a few hours sometimes to test. Sometimes those are tough to get into. There's not that many neuropsychologists, so sometimes, like I said, the doctor doing those simple tests in the office, although they seem simple, they can sometimes uncover things early. But there's other things that we can do. So the best thing that the doctor should start with is just a thorough history. What is this person forgetting? So let's say if the person's not giving the history, what are you noticing about the changes in their memory that you know they weren't doing years ago? You know, someone who was really good about cooking, and all of a sudden they're having trouble cooking because they can't remember the recipes. Or they were really good about sending cards to all the grandkids, and all of a sudden they're not sending those cards out anymore because they're forgetting. So things that are different for them than the way they used to be. When is it happening? Is it a certain time of day or when they're tired? What about the risk of Alzheimer's? What are some of the risks? One is your family history. If you have a family history where someone did develop dementia in their 60s or 70s, even if it wasn't called Alzheimer's, it could have been an Alzheimer's diagnosis at a time when doctors weren't using that term as often. Oftentimes dementia was used as the term, but it might have been an Alzheimer's, so you don't know. There is some genetic testing we can do, but the genetic testing just tells us if you're at risk. It doesn't tell us necessarily that you're going to get Alzheimer's, but there is some testing we can do. The other things, though, that can increase your risk are, did you ever have a car accident with a head injury where you got knocked unconscious? Or did you play football, soccer? Did you get hit in the head because you fell off your bike and you got knocked out? Head injury actually is also a risk of Alzheimer's disease, so you want to tell your doctor about that as well. And then the other thing is, you know, the doctor should look at your medications. Are you taking medications that could be affecting your memory? And then the memory testing. We talked about, you know, the simple tests the doctor can do in the office. There's also the neuropsychological testing. And then brain imaging. So brain imaging means the doctor either orders an MRI of the brain or a CAT scan or CT scan of the brain. Now, can the doctor see Alzheimer's disease on an MRI or CAT scan? No. But what we're looking for is, does the brain look healthy, or is it starting to have some shrinkage in certain memory areas that could be caused by an underlying Alzheimer's disease or other dementia? So that's what the doctor can see. What they can't see is if they look at the MRI and say your MRI is normal, doesn't mean that there's no Alzheimer's there. It means that they can't see it whether it's there or not. You have to do a special type of scan. And there are special CAT scans that we do. Something's called a glucose CAT scan, which looks up, are the cells taking up glucose and working? There's also something where we can look at proteins like amyloid protein, which is the protein that we know accumulates in the brain tissue of people who get Alzheimer's. So the doctor could order that type of PET scan. It is covered by Medicare now. It wasn't a few years ago. It just got approved in the last year. So you do have to ask the doctor about it. They're going to have to do a bit of work, though. So don't be surprised if they get a little resistant, because they have to do extra paperwork in order to get it covered by Medicare for you. But if they do the right thing, it's the PET amyloid for that. But if they do order it, it does get covered. And then other things is they should do blood tests. Just, you know, are your kidneys in good function, your liver in good function, making sure you're not anemic, checking some vitamin levels, checking your thyroid. Those should all be a normal part of that annual visit. Okay, these are some pretty pictures. So these are different types of imaging that we can get. So this one is a brain MRI. And like I said, this just shows me how healthy does the brain look. It doesn't show me if there's Alzheimer's there or not. I can't look at this and say yes or no. It can give me some hints. This one is an amyloid scan, and anything that's yellow or red shows that there's higher levels of a protein called amyloid in those areas of the brain. So this is an abnormal amyloid scan. This one is a tau protein scan. And this, again, where it's red or yellow, is elevated levels of that tau protein. So the doctor can order this one. This is a protein, the amyloid scan. They can't order this one yet. It's not covered by Medicare. But this one they can. And so this one, if you have memory impairment and you have elevated amyloid, that is really close to 100% certain that it's an Alzheimer's process and not something else. So the doctor can get a lot more specific with that than they used to. The other ways the doctor can find out if that protein is elevated is doing a spinal tap. or for spinal fluid, which we call CSF. There's also some blood tests now that are coming out that can detect those protein levels in the blood tissue. They're not covered by insurance yet, so those won't be ordered, but this one is right now ordered, or is covered, excuse me. So let's say you do go into your doctor, they do an evaluation, and they say, you have mild cognitive impairment, and I think it's due to an Alzheimer's process. So, or they say, you have some cognitive impairment, I'm not sure what's causing it, but that's the diagnosis I'm giving you, or memory-related cognitive issues. So what should you ask at that point? I think you should ask the doctor, and they may not be able to answer this, but I think you do want to know exactly what are the terms they're going to put in your chart. What exactly do they think this is? And if they don't know for certain, can they send you to a specialist to find out what this is? The other thing you want to know is there anything in the rest of my medical history that we could do today? Like, is my blood pressure elevated? Could we check on that? How is my cholesterol? How's my blood sugar? Could I exercise? I'd like to exercise. I've heard exercise is good for brain health. I've heard 30 minutes of walking a day or some other activity is healthy for my brain. Am I healthy enough to exercise? So maybe your doctor wants to take a look and make sure that your heart's in good shape and that it's safe for you to exercise. What if you have difficulty walking or you can't really walk fast? Then maybe the doctor could suggest maybe like a stationary bike, or maybe working with physical therapy first to get to the point where you're in good shape to exercise, and then you can get up to those 30 minutes of exercise. What kind of diet should I be eating for my brain? See if the doctor can give you some information for that. This is not common for doctors to give nutritional advice, so this is something you probably have to look on your own, but there is something in the Alzheimer's world called the MIND diet, M-I-N-D. It is really very pronounced data on how much just eating healthy can actually improve your brain health. So something you can do. The MIND diet tends to be based on lots of fish, healthy fish, vegetables, fruits, not a lot of fried food, not a lot of cheese, not a lot of sugar, reducing dairy actually. So the MIND diet you can Google. We do give out little magnets for people so that when they go to the store, you put on your list, is there a MIND diet food I could buy today and start putting into my diet? So that's just something to think about, just simple changes like that. The data is if you can eat a MIND diet, eat the MIND diet fully compliant every day, be very strict about it, you can actually reduce your risk by about 40%, 40, which is quite a bit. But for any of us in the United States, it's pretty hard to eat like that every day. So that's why I try to just take little bits and say, let me order one, let me get this vegetable, let me get this nice little piece of fish or this chicken, whatever it is. I'm not going to go through McDonald's or buy a processed food today. I'm going to instead make my lunch or my dinner. And those little changes are going to benefit you over time. It's not going to be overnight, but it is the way. I think it's also the best way to keep those changes, those healthy changes in your habit, is when you do them a little bit slowly and try to just do it on a daily basis. Again, talking about your blood pressure, how do you take care of your brain, get good sleep. So if you snore, your loved one snores, sleep is a really important part of brain health. When we sleep is when the brain is cleaned. Our body goes in and gets rid of some of the toxins and toxic proteins while we're sleeping. So if you don't get good, restful sleep, that can actually, over time, increase your risk as well. So if there's something that's disturbing your sleep, maybe your mood, whatever, that is something that you want to talk to your doctor about. You have to be careful, though, because a sleep medicine is probably not necessarily the answer, but maybe there's something else. If there's a sleep apnea diagnosis or something, getting that treated would be helpful. If you are having any mood issues, anxiety or depression, that tends to disrupt sleep. And if you can help get that addressed, that sometimes can help improve your sleep as well. Now for medications to help, if you do have a diagnosis of Alzheimer's with memory impairment, there are some medications like donepezil, memantine that are what we call symptomatic therapies. But then, like I said, there are recently from the clinical trials, there are disease-modifying medications that are approved by the FDA. There's also clinical research that you can be a part of where early medications that we think might be beneficial to treat Alzheimer's are being tested. And they're being tested sometimes in people that don't have the disease yet. Sometimes it's a prevention study where we're trying to figure out, can we prevent someone from getting any decline in their memory? So there are studies like that available where even if your brain is healthy, your memory is good, you could still participate. And again, you're part of that science team to help us get the right data that we need. So what's the importance of clinical trials? Number one, no medication that you get prescribed today or even that's on the counter, like when you buy over the counter at Walgreens or CVS, they all had to go through a clinical trial at some point. The exception is the supplements, vitamins, things like Prevagen, things like Neuriva, those don't get tested in clinical trials. In the United States, you can put something on the shelf and say, this cures memory, and you don't have to prove it at all. So that's not how our prescriptions work, though. When you get prescribed a drug, that drug went through different phases of study to determine what are the side effects. Does it work better than doing nothing? Is it toxic or not? Does it work is really the main question that we're trying to get to. It's important that we're all part of that. Like, we will never get medications to people to benefit them with diseases if we don't do clinical research or clinical trials on it. The one thing about clinical trials is it's also a way for you to be a part of the science team, but also for you to get information. Part of the clinical trial process is the doctor and the team telling you everything that we know that's available for treatment, what we know about the drug that's being tested, what testing you'd go through, and then getting information during the course of the period. A lot of our trials are 2, 3, 4 years long. So we have patients that come into our office almost every 30 days for 2 or 3 years. I don't know if you've ever been able to see your doctor every 30 days for a few years at a time. So they get to be very familiar, and they can ask questions, and it is our responsibility to answer questions that you have while you're in clinical research, even if it's something not related to the study. We can't keep anybody in a study. If a cure comes out, I can't keep you in a study if I know that there's something better out there. And so that's where it really is a team approach, and you're part of that process. We are having difficulty with making sure that the diversity in clinical trials is diverse. Some of the studies, if they come out and they only are with one type of person, how do I know that that's going to be beneficial to all of my patients, regardless of their racial or ethnic background? I need to know that, and the only way we're going to know that is if we participate in clinical research to be sure that that medication works the same in everybody and is beneficial to all of the participants. And so that's where being a part of the research is really for all of us to improve the quality of the data, is having a very diverse participant population as well. So if you were in a clinical trial, clinical trials are very foreign to most people. I mean, most people think it's experimental, it's your rat, things like that. I hope that, and I think maybe just the way that my research center operates is, it is our responsibility to be sure that we explain in very great detail to the person who's interested in participating all of the information that we have available, and making sure we explain it in a way that they can understand it. I can't talk over somebody or fluff it off. If you don't feel comfortable, you don't think you had all your questions answered, or you still have some questions, we need to figure out how to answer that question. And the other thing about research, it is always voluntary. You can walk out at any time and say, I don't want to do this anymore, or let's say, like I said, let's say the cure for Alzheimer's comes out and we have a trial going on and you're in it. I can't say you stay in this study until it's done. I'm like, there's something better out there. Let's stop this study. Let's go to that thing that's better out there. So making sure that that information is always being shared. The informed consent process is you being fully aware of what you're getting into. And it is my responsibility to always answer those questions no matter when they come up. Most of them come up at the beginning, but even during the study, you can have questions. Principal investigator, that means the doctor that's running the study. That would be me. Study partner, because we're doing memory studies, we do testing sometimes where we need someone to tell us about how you're doing and how you're remembering at home. Blinded means I won't know if you're getting the study drug or placebo. You won't know. my pharmacist, nobody will know. We're not supposed to know because we don't want to taint, bias the data. If I know you're getting the drug, I'm going to be like, you seem like you're a little better today, maybe, and you'll do it too. There's a placebo effect that we all can be biased by. And then there's other things. A lot of our studies, we call them IV infusion studies, where you get the study drug by IV. A lot of times there's lumbar punctures, but not all of them require it. Some of them it's voluntary. It's only if you want to do that particular test to have the spinal tap. There is usually the imaging, MRI and PET. So a lot of times when when you're looking to be in a trial, you can get information about your brain health because we do tests and we give you the results of those as well. And then investigational product is whatever the drug is that is being developed. And then phase of the trials, how early, where are they in the development of that drug? If you volunteer in a study, and this is where the foundation came in as, how do you get transportation to go to the study site every time for every visit? That's something that when you do volunteer for a study, that can be arranged for you without your expense. The one thing about being in research is it is not supposed to burden the person who's participating. It is meant that you should be paid appropriately for your time. You shouldn't incur any travel expenses. If you live out of state and you have to travel and stay overnight in a hotel, that should be paid for by the study. So most of the time the research will not burden you financially. It will take your time, but that is hopefully the thing that you have as a burden. We can usually try to work with you to try to reduce that as well. There's lots of different tests that are done. A lot of the studies have different amount of study visits. You won't know if you're receiving the medication or not unless it's an open label study. And then most of the time we'll explain to you what tests will be done during the study. So I like to talk about how to not treat Alzheimer's and how to treat it. How to not treat it. Ignoring it. When you know someone's struggling and you see them, don't ignore it. Please help them. And sometimes it takes time to convince them to go to the doctor to have it evaluated. Don't go for unapproved therapies. So again, someone who tells you, drink green tea and take this whatever, that'll cure it. It worked for my mom or whatever. If it doesn't have data behind it, it probably is too good to be true. And that's true sometimes even in the medical community. Books have been written that are called The Alzheimer's Cure and things like that. We have not yet found anything that we can absolutely cure or prevent Alzheimer's yet. We're close, but we're not there yet. So someone who tells you that is probably overselling and overstating what they really can do. So if it sounds too good to be true, it probably is. The over-the-counter market is a billion-trillion-dollar market. If you want to make money, put something on the shelf and sell it and say that it helps memory. But for the most part, those things that say they can cure memory that are just over the counter really don't do anything and probably aren't going to help you. So I'd rather you take your $30 a month that you're going to use to buy that over-the-counter thing that's not going to work and buy some salmon and some vegetables and some fruit and maybe a Y membership so you can work out. Because that's going to be a better use of time for your brain health than spending it on a supplement that has no evidence behind it. All right, and if someone does have memory loss, meet them where they are. Like I said, you may notice changes in someone, they don't recognize it. It may take many, many conversations with them before they will let you even talk to their doctor about it, but don't give up on them. Keep on trying to see what you can to help them. And then how to treat Alzheimer's. Early diagnosis we're finding is better and better. If you can be a part of a science team for a research trial, that's also helpful. Assess the needs often of someone who does have a diagnosis. It does change over time. They might need more help later on than they need in the beginning. And what may work in the beginning for someone with a diagnosis may not work later. They might need to adjust that. And be sure that if you are a caregiver, that you are getting support for yourself. Caregivers are at increased risk of high blood pressure, depression, health issues. We've got to take care of the people that are taking care of others, always. So if you know someone who's a caregiver, see what you can do to help them as well. And this is my last slide. We're going to go into question and answer because I know we've already got some questions. This is just more information about the foundation. We have our website. There's also for the research center, if you're interested in research. They're interested in hearing more about research. We do have someone at the research center that can call you back and talk about what's going on for research as well. What information do you need to learn about research to feel like you understand it or would feel comfortable even being a part of it? Learning more about it usually reduces fears. You know, we always are more fearful of the unknown than the known. So I think the question is just like, how do we get more information out in the community? And part of it is not even if you decide not to participate, learning what is out there and being studied will help you so that when those medications do get approved, you're aware that your doctor can now prescribe this medicine. It's been tested, it's been shown to be beneficial, the FDA approved it. Finding out early so that you can go to your doctor and say, I think we should try this. Because what we're finding is that when you don't participate in the research, you're learning about these medicines much later, because a lot of doctors don't stay up with something that just gets approved. They don't feel comfortable yet, so you might have to kind of bring it to them and say, can we look into this? Maybe this is something that's appropriate for me. So as far as the research participation, I think we just need to do more discussions, have more conversations. And part of the foundation is, what are the barriers? Maybe the barrier is, like in Fort Worth, there aren't a lot of Alzheimer's research centers. We're actually working to put one over here. We're in Dallas. We have patients that come over from Fort Worth, but getting from Fort Worth to Dallas is difficult. How do we break down that transportation issue for you? How do we help with other things? So I think so the more we can talk about it, probably the more we can address that issue. So, the one thing with caring for somebody who's maybe having memory impairment is, in that moment, they might be getting really frustrated with whatever it is. Either they don't want to talk about what you want to talk about, or they don't want to do what you want to do at that point, or they don't want to talk to their doctor about their memory issues. I find that you just have to really kind of step back, let them be frustrated, because it's happening to them, and you're doing your best to try to assist them, but sometimes you do have to step back and kind of go back to it when they're calmed down, or change course a little bit and see if you can hit it in a different direction. Grief can be different for everybody. The time course for grief, how someone reacts to grief is different for everybody. And there does tend to be, with grief, there can be depression. But it can also, for someone maybe, if the close person that died was helping them, and that person passes away, not only do they have grief, but they now are having difficulty functioning because that person used to help, and nobody knew that that person was helping. We see that a lot with couples. If the wife or the husband was helping the other one and then they pass away, all of a sudden nobody's helping this person anymore, and the dementia may come forward. So we do, when you evaluate for dementia, ruling out that it's not depression that's causing this, because depression itself can make someone appear very forgetful and different. But if you treat the depression, that can become normal. But there are ways to screen for depression before we say, oh, it's not depression, it's dementia. So usually there is a way for them to test for that.